Hey everybody, it's Matt Hsu from Upright Health, and today I wanted to talk with you about lower back pain and hip pain. In the last 2 days, I've talked with one lady from Sweden here at the studio, and we worked with her for some issues she was having with her hip, and also did a Skype session with a lady who's in Montana, and she's been having consistent chronic low back pain just all along here, this little band right along the top of the, right along the iliac crest, just below the ridge of the iliac crests. And both of them had very, very, very similar issues that were causing them some problems. Now, both of these ladies have been through countless therapists, trainers, doctors, physical therapists, whatever professionals are out there that attempt to help people with hip and back issues. Both these ladies have been to tons of them. And this is a really common pattern. I have seen this innumerable times in my life with different people in doing what I do. So I wanted to talk about this very quickly, talk about two things that you need to think about if this sounds like you. So the first thing is, if your back is hurting, you're having some hip issues, one of the key movements that we want to see you be able to do competently is bending at the hips. And for many people, this is not at all a natural motion, and we spend a lot of time retraining this motion for a lot of people. Particularly for women who do not have experience lifting weight, this can be very difficult. For anybody who has no experience lifting weight, this can be very difficult. And if you've never learned how to lift weight correctly, this is still very, very difficult. So the motion, we've talked about this a lot on our channel recently, is the deadlift, right? It's this hip hinge motion where you're trying to be able to fold at the hips rather than folding at multiple segments in your spine. The reason I bring this up is because both ladies I saw, and I've seen this again many, many, many times, had this issue. And rather than address that issue, all the professionals these ladies had seen were basically telling them, there's a dysfunction with your whatever, your transversus abdominis isn't working, your multifidi are not working, maybe it's because your thoracic spine doesn't work well, when there was a real clear movement pattern problem from the get-go. So if you tell me, every time I go to pick something up, my back hurts, I have to see how you move when you pick things up, right? If I tell you, for example, I don't know what the problem is, but every day my thumb just kills me. I wake up every day and I go to work, and in the afternoon, by the end of the day, my thumb is just killing me. You're going to have to wonder and investigate the cause and see what I'm doing on a daily basis that could be causing my thumb to be so painful. And if every single day I go to work and I'm hammering a dumbbell on my thumb, you have a very clear cause of my thumb problem. Okay, so both these ladies, and again, this is not just them, I don't want to single them out, this has happened 100 times, if not thousands of times. They go to pick something up, and when they do this. Now, we've talked about this in many videos, but this is creating all kinds of negative, just bad things in the lower back. We'll say it that way. When you go down like this, you have rounded the lower back and created a situation where it's going to be very easy when you push this way, right? When you try to leverage this thing off the bench, you're going to create a force in your lower back that is going to make your back hurt. So if you're doing this every time you need to pick something up, you really should expect the lower back to not feel so good, because you're basically gapping the vertebrae. You're forcing those lower back muscles, which function best to stabilize your spine at this length. You're forcing them to go like that and spread. So you've destabilized your lower back. You gotta pick it up, whatever the weight is. Maybe it's light, it's not too bad, but as soon as you pick up something super heavy, it's gonna really hurt you, okay? So number one is look at your form. Think about keeping your lower back in this nice neutral position so that the spinal musculature can stabilize and that you can pick things up without a problem. The second thing to think about is have strength. Do you have the strength, actually, to pick things up that are heavy but still not super heavy, right? So you have the right form, but then do you have enough strength to handle something that's, you know, half your body weight? Do you have enough strength to handle something that's 60, 70% of your body weight? The reason I've set this somewhat arbitrary marker is because what I've seen, especially with ladies that I've worked with who are really weak in their backsides, it's somewhere around that 50, 60, I normally will say like 60, 75% of body weight, where they're able to pick something up around 60 to 75% of their body weight, where the strength levels have picked up enough in the backside where they no longer feel like their back hurts, right? I've seen multiple people where, you know, months and months and months and months of chronic back pain just stopped happening once they're able to pick up about 60, 75% of their body weight. So that's another issue, right? So once you get the form, you need to build the strength to pick things up. One of the lady that was here yesterday had a lot of trouble with even 10-pound dumbbells. So that's a total of 20 pounds. This lady was maybe 110, 115 pounds. She's kind of muscular, but let's say 110, 115 pounds. If she can only handle 10-pound dumbbells, that means she can only handle a tiny fraction of her actual weight. The strength levels required to even just lift her up here, just her own body weight, was already approaching her maximum ability. So then for her to do any other activity, whatever sport it is, if she needs to stop, turn, or do whatever, all that stuff is going to be really challenging because she doesn't have the strength to stabilize and work with her body and move her body. So think about strength, number two. Number one, think about form and work on those things to make sure that you can move well, feel good, and enjoy your life. I hope this video helps you, and please remember that pain sucks. Life shouldn't.